Welcome to your cardiovascular and peripheral vascular examination. My name is Dr. Calliope, and I'm going to be taking care of you today. Do you mind if I just grab your name and date of birth? Very good. And is that your preferred name? How do you like to be addressed? Wonderful. So, today we are going to be taking a look at the health of your heart, and we're also going to be looking for any signs of peripheral vascular disease, primarily in the limbs. We'll take a look at your hands, your nails, your face, your eyes, obviously a lot on the chest, and we'll also be looking at your legs and feet. It's a pretty comprehensive examination. Okay? You have any questions for me before we begin? Very good. If at any point you do, just let me know. And for this examination, I am going to need to be touching you. Is that okay with you? Do I have your consent to do that? Wonderful. Real quick, I would love to show you a little bit of the anatomy of the heart. I have a very quick, kind of roughly sketched sort of diagram, but I can give you a little idea about what I am looking at and listening for when we get to the heart, if you'd like. Okay, give me just a moment. So I actually have a little tattoo here of an anatomical heart. Now, this is not all the way anatomically accurate, but we can get the general idea. So, firstly, we have the superior vena cava here. And then this big guy here, that is our aorta. We have the pulmonary artery here. And we have the pulmonary veins. Now, I don't have the inferior vena cava here, just got superior, but we can get a little glance at the ventricles and the atria. So this is going to be our right atrium, right here. And this is going to be our left atrium, right in here. And then we also have the left and the right ventricle. These are a little harder to see here, but this would be about in this area, whereas the left ventricle would be about right here. When we listen to the heart, we often start with the aortic valve, and that would be right in this area. We have the aorta here. We have the aortic valve, and then we can move on to the pulmonary valve, and that would be with the pulmonary artery here. And then we move to tricuspid. So we have our vena cava here, which, again, a little anatomically incorrect, but that would be around in this area, right in here. And then we also have our mitral valve, which is going to be right here in this area with the left atrium here. So this is just a little look into what your heart looks like in a more artistic sort of way, and where a lot of these structures are going to be. So we've already gotten scrubbed up, and now we want to take a little look at you. So I am going to look at your general appearance. So we are looking for things like any cyanosis or paleness/pallor in the skin that might signal a circulatory issue. Looking to see if you have any shortness of breath. And as we've been talking, you haven't seemed to have any problems with breathing. Is that correct? Good. I'm looking for example, a malar flush right in the cheeks here. Looking for any signs of that. And we are also looking for any signs of edema or swelling. Oftentimes, this is something we can see in the ankles and the feet, but just upon cursory glance, doesn't seem to be anything going on with your legs or feet. So we are going to move to the upper limbs. We're going to look at your arms, your hands, and your nails. If you wouldn't mind, I'd like to get a little closer. Okay, just a little. And then let's take a look at your arms and hands. So in the hands, I'm looking for any changes in the nails. I'm looking for that cyanosis or pallor. Looking for any signs of xanthomata. We can find that in a few different places. I just want to look at your wrists here. And also, if you could just show me your elbows. Good, that looks good. Okay. Now I want to look for signs of disease in the nails a little closer. So we will be looking for example, lesions or nodes. And while I'm getting up close with your fingers, I'm looking for something called arachnodactyly, which would be pretty obvious straight on, but just taking a closer look. Arachnodactyly means spider fingers. And there isn't any sign of gangrene either, which is also fairly obvious to spot. While I'm here with your nails, I want to check the capillary refill. So I'm going to be pressing on the nails here. And when I press here and lift off, the flesh should pinken up, should flush back with blood within about 2 seconds or less. I'm just going to do that on your fingers. So I'm just going to be pressing on the fingers here. Press, release, press, release, press, release, press, release. Last one. Press and release. Good. Good circulation. Okay. Let us take a look at your fingers for any finger clubbing, and then we'll move on to the pulses. So if I could have you take your index fingers here and put them back to back so that the nails are touching each other and the most distal joint here is touching, and we're going to look for this little window in the middle. If this little window is not present, that can be a sign of finger clubbing. So if you could just do that for me, just put your fingers together like that. Good, okay. And then I would like to palpate your radial pulse first, okay? So let me just take one of your wrists here. I'm going to palpate both, but let's start on this side. So take my fingers, and the radial pulse is right in here. So you don't want to do it with your thumb because you might feel your own pulse instead, but right at the radial artery here, we can feel the pulse. Let's go ahead and do that here. Good. Excellent. And I'm going to palpate the other one. This one won't necessarily be for as long. I'm not looking for beats per minute per se, just more the strength and its rhythm. Good. Now we're going to be bilaterally palpating them. And this is looking for a radial delay, or a delay in the pulses. They're not exactly synchronized, okay? So I'm just going to palpate both pulses here. And we'll just wait here and wait for them to sync up, or make sure they're synced up rather. Okay, good. Now let's look at the brachial pulse. Brachial pulse is going to be in the crook of the elbow here. We have our cubital fossa right here. We'll be feeling in that area. So I'm just going to take your arm. Let me maneuver it a little bit here. This one's not as difficult as the popliteal pulse, but can be a little tricky. There we go. Good. And the other side. Let me just take a little feel here. Doing okay? Alright, just want to make sure. And okay, I think that's pretty good. Now I'd like to test for a collapsing pulse. And what I'm going to do is I'm going to be feeling your radial pulse and your brachial pulse at the same time. And I'm going to lift your hand and your arm above your head. Do you have any pain in either of your shoulders? No? Okay. So let me do it with this arm here. One hand is holding your wrist and feeling for the radial pulse. The other hand is feeling your brachial pulse, and I'm just going to very quickly raise it above your head, okay? All right, ready? Okay. And we're gonna sit here for a little bit. And let's drop down. I know that the nurse took your vitals, but I'm going to be measuring your blood pressure again. It's likely going to be different than when you first came in. You were sitting, and then you were walking, and then you were sitting again, and now we've been sitting for a while. So it should be a little more calm, ideally. So, grab my stethoscope. And we'll grab the sphygmomanometer. And let's go ahead and give this arm a little bit of attention. Good, and then let's bring this bad boy around. I am going to put the diaphragm of my stethoscope here in the crook of your elbow. And I've got the dial, and I have our bulb here that controls the airflow. And just going to make sure that valve is closed. Go. And then we're going to inflate the cuff. Okay, I'm going to let that deflate. We're going to do that one more time, okay? Alright, close the valve. Let's open the valve a little. Right. Let's go ahead and take that off. Pretty wily things sphygmomanometers are. We're going to be doing quite a bit with our stethoscope, and we're going to start with the carotid artery. Now I'm going to be first auscultating with the stethoscope, and then we're going to be palpating. The palpation may feel uncomfortable, okay? I'm going to do one side at a time. Since we're dealing with the neck, that's somewhere we don't really want people to be pushing in at, so I'm going to be very gentle about it, and it doesn't last too long, but I do want to give you ample warning. We are going to auscultate with the diaphragm of our stethoscope here. Diaphragm, bell, diaphragm, bell, bell, diaphragm. And I am just going to take a little listen to one side and then the other. And just right normally to start. And then we'll do a little accentuation maneuver. And I'm going to have you hold your breath for me. So take a deep breath in and hold. Good. Okay, you can exhale. And we're going to listen to the other side. So we are listening for bruits or audible heart murmurs. And should there be anything out of the ordinary, then I wouldn't want to palpate the carotid. Okay. And if you could take a deep breath in for me and hold. Good. Okay. Sounds good. You can exhale. There you go. All right. And now I'm just going to be palpating one side at a time on your neck. Okay? All right. So just very gently, with just enough pressure that I can feel. Definitely not going to be exerting any more pressure than necessary. Good. And the other side here. Okay. All right. Let's record that down. Let's take a look at the jugular venous pressure. So I am going to have you recline back for me. There you go. And if you could turn your head to your left. Good. And I am going to be watching your neck here, right around the sternocleidomastoid muscle. And we're going to take a look at the pressure of the blood flow in the jugular vein. Okay. If I was a little concerned, we could actually measure this, but it looks pretty good. And I'd like to check for hepatojugular reflux, and this involves me pushing on your liver. That's the hepato part. That prefix there means liver. So, do you have any pain in your abdomen at all? Any tenderness? No. Okay. So, I am going to just push in on your liver. Okay? So, this is going to be a little uncomfortable. Doesn't last too long though. Press. And release. Okay. Alright, that looks good. You can go ahead and turn your head back to neutral and come up to sitting. And let's take a look at your face. So, namely, I want to look primarily at your eyes and your mouth. So, I have a little pen light here that's just going to aid in me seeing if there's anything going on. It's very weak. It's just a little aid here. And I'm looking at sign of corneal differences, any rings in the eyes. I'm going to take a look at the conjunctiva real quick. I'm just going to be pulling down on the eyes and I want you to look up. Okay? Just going to pull down, look up. Good, and I'm going to pull up and I want you to look down. Pull up, you look down. looking for signs of xanthelasma as well. Basically just making sure your eyes look pretty clear and bright. The sclera is the correct color. Things of that nature. Okay, let's take a look at your mouth. So the color looks correct for your skin tone, and I'd like to take a look at the corners of the mouth, if you don't mind. If you could just open your mouth a little. Good. Okay, good. And I'd like to take a look at your tongue, more specifically underneath your tongue. So if you could open your mouth and lift your tongue to the roof of your mouth. Very good. All right. Okay, so no signs of central cyanosis, so that's good. Close your mouth. And have you been to a dentist lately? Okay. Have they mentioned anything about your teeth? Your teeth are actually very important for heart health. No? Okay, good to know. So let's move to the chest. I'd like to look for any scars, any deformities, looking for pulsations, protrusion, any sinking in, that sort of thing, okay? So, just going to look here. Good. And I'm not seeing any scars, so we haven't had any surgery with the chest wall, have we? No. Just want to make sure. It would be kind of a big thing to forget, but you never know. Okay, all right. So now I'm going to be palpating the apex beat, okay? So I would like to just measure here. This will be at the mid-clavicular line, clavicle being your collarbone, and the fifth intercostal space down. So from the sternum, we can count the intercostal, the spaces between your ribs. And then we match up, and that's where it should be. If it isn't there, that is a problem. And we can feel for the apex beat. Okay, good. I'm going to record this down real quick, and then we'll feel for any heaves and thrills. So firstly, I'm going to feel for any heaves, and this is going to be more along the left sternum border here, and we are going to keep our fingers vertical here, and we're going to feel with the heel of our hand. Okay, and then we're going to feel for any thrills. And I will be doing this along each of the valves. And these are palpable heart murmurs. So we are going to start with the aortic valve. And the pulmonary valve. And tricuspid. And mitral valve. Very good. No heaves, no thrills. You could get that on a little button. No heaves, no thrills. And let's take a little listen to the heart. Now I am going to be listening with both the diaphragm and the bell. So the diaphragm of the stethoscope is used more for the higher pitch sounds. It's better at picking those up. The bell is better for the lower pitch sounds. So if I were to, for example, listen to my own heart, if I listen with this, it's going to sound higher in pitch. And if I turn it to the bell, then it's going to sound a lot lower. Okay? And let's go ahead and listen to everything. We're going to go backwards. So we'll start with the mitral area. Just keep breathing normally for this one. And then we can come to tricuspid. And let's go up to pulmonary. And then up to the aorta. And then we can come in with the bell. So let's start again. We're going to go from mitral, and tricuspid, and then pulmonary. And then aortic. Okay. I'm going to record this down and then we're going to do some accentuation maneuvers. You're going to be doing a little bit of moving around. Okay. So I'm going to have you sit forward for me, and I'm going to listen to the aortic area. And I'm just going to have you lean forward as I auscultate the aorta. Good, and now I'm going to have you roll on to your left side. Yep, we're going to have you roll. And I am going to listen more to the mitral valve, right? Okay. We're going to start with the diaphragm on the mitral valve. And then I'm going to switch it to the bell. Now, if I were to say bell end, those in the UK might raise their eyebrows a little bit. You're going to do what to the bell end? Good. Okay. Go ahead and come back. And we're going to take a little look at your back. And I am going to do a little auscultation. We're going to do a little percussion. Not in that order, of course. But I'm going to just get my little table out of the way. Then we're going to go to the back. So on the back, This is the posterior chest wall. Looking for anything out of the ordinary. And we're also going to do some percussion. So with percussion, I am going to be tapping on your back. And I'm going to do this from side to side, downwards. We'll start right here. We are listening for any stony dullness. And I want to take a listen for any coarse or fine crackling in the lungs. So I am just going to have you take a deep breath in for me and out. Deep breath in 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 and out. Last one. Deep breath in and out. Good. No crackling in those lungs. Now I'm just going to be doing a little bit of palpation on the sacrum, so we're like the small of your back kind of area, and we're going to feel for any edema in the sacral area. Just going to feel if there's any swelling here. Okay, and then we are going to come back around. Now we're going to be getting into the abdomen a little bit. This is more for our peripheral vascular examination. First, I would like to take a look at the abdomen. So if you watch very carefully, if you stay still, you can see just a little bit of pulsation in the abdomen, and this is your aorta. And I just want to take a look real quick. Just make sure that pulsation is not too weak, not too strong. And we are going to be palpating this. So I'm just going to take a gentle touch here. We're going to feel the aortic pulsation here. Good. Okay. And then we are going to grab our stethoscope and we are going to take a listen to the aorta, and we're going to listen to the renal arteries as well. So we're going to come up right where we had palpated. This is just above your navel here. You can just breathe normally. And then to listen to the renal arteries, we go just a bit laterally on each side. And this side, just a bit lateral to the midline. and then we are going to move on to the lower limbs. So we want to do our inspection, looking for similar things that we do to the upper limbs, the face. We'll look for pallor, cyanosis. We're also looking for gangrene, rubor. Have you had anything odd going on with your legs? We've covered swelling, but any sort of skin changes? No. Okay. So I'm going to come down the legs here, and we are going to look for any pedal edema. So we'll look in the feet and the ankle for swelling here, and it looks like not seeing any signs of hair loss here, and the muscles feel pretty good, so no wasting there. Okay, and we don't have any edema there, which is good. And then we are going to check our temperature and our capillary refill here. So like the arms, everything should be essentially warm. We don't want you to be cold or clammy or too hot, right? So I can feel with the backs of my hands, on the feet, up the leg. Good, and then we can test the capillary refill. Just like on your fingernails, we can do that on the toes as well. Okay. We can just press here and release. Press and release. Very good. Okay. And then we're going to be doing a lot of pulses here. So I am going to be feeling the femoral pulse, and this is kind of a sensitive area, just so you know, but it'll be right about in here. Okay, is that all right? Okay, good. So we are going to feel the pulses here, and then we're going to look for a radiofemoral delay, like the radial delay. Good. So with the radiofemoral delay, one hand is on the femoral pulse, one hand is on the radial pulse. If I could have your wrist here. Good. And then we're going to feel for any delay. The other side, one hand on femoral, one hand on the wrist, right at the radial pulse. Good. And then we're going to bring out the stethoscope for one last hurrah. And we're going to take a listen to the femoral pulse. Side. Okay. I'm quite pleased with that. So let's go ahead and take a look at the popliteal pulse. So this one is kind of difficult to get into, and I might not feel it even. So I'm going to have you flex your knee a little bit. There we go. And I am going to try to wrap my hand around and get into that pulse there. Okay, there we go. Good. And the other side, let's go ahead and flex the leg. Yep, just a bit there. And then we're going to try to get into the pulse there. That one's a little harder. Okay, there we go. Takes a little bit of feeling around. Good. Okay. And then let's go ahead and get post-tib. So, going to be feeling along the lower leg here. We'll get right in about there. It is interesting how much medicine still relies on touch, but our hands are one of the most sensitive tools that anyone can use. It's really quite fascinating, really. Good. And we're going to take a short break here while I just write this down. And then we're going to do a couple more things. First, I'm going to check dorsalis pedis real quick. I'm going to do that pulse. And then we're going to check sensation a little bit. Okay, very good. Now, I'm going to sneak past you real quick. And I'm just going to grab one of my cotton swabs. Good. Here we go. So I am going to be testing the sensation on your limbs. So I am going to just stroke the jaw here so you know what it should feel like, right? Okay, so you got that. I am going to have you close your eyes and let me know when you feel the cotton bud. I'm going to do a nice stroke. Okay. Right. Good. 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 Mm-hmm. Good. Okay. Good. Good. Mm-hmm. Very good. Okay. And the last thing we need to do is the Buerger's test. And while the name is a little more appetizing, it is actually spelled differently. It's Buerger. So I am going to be lifting your legs up, and we're going to be sitting there for about a minute and then look at how the legs change color based on the blood flow. Okay, so I'm going to hold your legs and we're going to lift them up. All right. This is going to be just a little bit. almost there. This test can be done for 1 to 2 minutes, so I like to do more of a 1-minute kind of thing, unless I have reason to believe that we need to go the full 2. Alright, let's come down. And I'm going to have you swing your legs over so that your legs are hanging off of the table here. Alright, they should look pretty pale for a second, and then they should pink right up as the blood flow comes back. Good. Alright, that looks good. So that will conclude our little cardio and peripheral vascular examination. You have any questions for me? Any concerns? Okay, wonderful. Thank you so much for being an awesome patient. Got you all signed off, and I will bid you adieu. Thank you so much for coming into my office today. I hope you have a whale of a day and a good rest of your night. Thank you. Bye now. Thank you so much for watching this video. I really appreciate it. I create primarily medical, alternative medicine / pseudoscience and personal attention ASMR roleplays. If you want to check out a specific category of my videos, my channel playlists have everything from sci-fi to historical to even fantasy videos. If you want to support my work, consider checking out my Patreon profile in the description box, where I offer early access to videos, exclusive content,